let's go back to our top story where two nurses were allegedly removed from a clinic in Limpopo last night by an armed man who then forced them subsequently into bushes and continued to rape them there. Let's now welcome Jacob Molepo, who is the Democratic Nursing Organization of South Africa, Denosa, Limpopo Provincial Secretary. Jacob, thank you so much. We do appreciate you taking time out to talk to us about this harrowing incident. Good afternoon. So you have been made aware of this particular incident. Firstly, what is your position as Denosa, and how do you then seek to get justice for your members and also act against the employer or the security company? Jacob, please unmute.
No, thank you very much. Good afternoon and to our listeners. As Denosa, we are devastated and shocked by the incident which happened at Trinity Clinic this morning. As the organization, we really condemn the incident because the incident really reveals all the progress that was made in terms of ensuring that the communities access health services even after hours. As the organization, we did held a meeting with the department this morning at the clinic where we made a submission that number one, the affected nurses must be given the psychological and physical support as they are traumatized. And then indeed the department referred them to the hospital. They are receiving assistance from the psychologist. And secondly, the clinic, we made a submission that the clinics be temporarily closed to ensure that their colleagues also receive psychosocial support as they are also traumatized. And we lastly make the department to close the night shift or night duty services indefinitely until the situation is normal in the clinic. And what is really concerning us is the competence of the security company which is deployed in that facility, because we are still having questions without an answer, because is this really unbelievable that one particular person, even if he's armed, can overpower 3 security officers? So those is our position as the organization. We really condemn the situation or the incident seriously so. And we are calling upon the community members because we believe that the perpetrator or perpetrators, they are familiar with the clinic, which make it possible that they are the residents within the clinic. We are calling upon the community members to come forth, assist the police with the information which can lead to the arrest of that perpetrator or perpetrators.
Now, Jacob, so what is the real issue then? The safety measures undertaken by the hospital, or it's the security company that you are laying the blame squarely at their feet? I'm asking this because we know in most instances, particularly in places of public government areas, these guards don't carry firearms or heavy artillery in order to deal with such situations. And criminals know this and actually take advantage, worse in a public space such as a clinic where the checking of weapons or processing of patrons is largely neglected. So how are you going to go about raising the issue of the conduct of the security company that will just tell you, well, we're not well equipped enough to deal with the perpetrators as we are not armed?
Yeah, let's indicate that we are going to have a follow-up meeting with the department on Monday. One of the issues that we are going to raise is that the competence of those security officers, because we are not even sure whether those security officers were capacitated enough to deal with such kind of situation where the facility is being attacked. Number two, we believe that the department must also ensure that the security companies employed in our facilities, they comply with memorandum of agreement as it was clearly indicated that one of the security officers in the facility must be armed. So currently, as we check, there's no clear indication whether those security officers were armed, of which we believe that the people who attacked the clinic, they have made a thorough assessment and we're quite aware that the security officers are not armed. So we are putting the blame on the security company. We are also not leaving the department in this situation, because it's the responsibility of the department to ensure that the security companies complies with the agreement of the memorandum of understanding in terms of ensuring that one of the security officers is armed. And again, in terms of the 24-hour service policy, the clinic must be manned by 3 security officers, of which one must be deployed at the gate to maintain access control. The other security officer must be in the clinic with the nurses to ensure that as and when the patients come during the night, they don't put the lives of the safety of nurses at risk. And the 3rd security officer must patrol the premises. So the situation really raises a number of questions, whereby the 3 security officers were attacked in the guard room. It is clear that the security officers were not discharging their responsibilities in terms of the expectation.
All right. And a very quick one, Jacob. I mean, you said that you've spoken to the department. The Premier, Dr. Popet Ramathuba, has already come out publicly to condemn the incident on social media. What kind of proposals would you then suggest as an alternative to just having 3 guards that are stationed outside a clinic with no arms and anything to protect the patrons, the staff, and themselves?
Yeah, our proposal as the organization is that the department must strengthen the security measures in our facilities. Number 1, we are proposing that the department must install the cameras in all facilities, we especially prioritizing those who are providing 24 hours. And secondly, they must also consider other monitoring devices, and including the panic buttons, to ensure that the security officers, including the nurses, they do have a panic button for in case if the security officers are attacked, the nurses can be able to press the panic button so that the armed response can be able to respond. Even the police can be able to respond to assist in the situation. Those are some of the proposals that we are going to put on the table to ensure that our members and the nurses, including the communities, they are safe when they are in those facilities.
All right, Jacob, thank you so much for your contribution this afternoon. That is Mr. Jacob Molepo there of Denosa in Limpopo, after 2 nurses were attacked and raped at a clinic while on duty in Limpopo.